Okay, everyone, welcome back. Hope you're all feeling refreshed. I would like to invite all our speakers and panelists back as we start to answer some of our attendees' questions and address some comments that they've left for us. Attendees, please continue to post your questions in the Q&A and comments in the chat box, and our support team will get them to us and we can ask them. So before we begin, we've got a few more introductions.
Let's start with introductions. As head of Animals Asia Vietnam Bear Rescue Center, Heidi Quinn champions a diverse international team of veterinary bear care professionals. Having lived in Asia, working with bears and in animal welfare for 11 years, Heidi recognizes the inextricable link between team wellness and the welfare experienced by bears in the sanctuary. She prioritizes her team's well-being in her leadership approach. Heidi researched and advocated for Animals Asia setting up an employee assistance program, which has been rolled out globally to all team members, giving them free access to mental health care and wellbeing support, and is a vocal proponent of accessing the service as she wants to break down the stigma surrounding mental health.
And next up, we've got Kyle Banton-Jones, who's a zookeeper and founder of Wild Enrichment, and that's a consultancy company focused on enhancing animal welfare practices through behavioural husbandry. So through guidance and expertise, Wild Enrichment have introduced innovative enrichment programs and techniques that have positively impacted the lives of countless animals. Kyle has also runs a fantastic podcast and website full of resources about animal enrichment. We've asked Kyle to join us on the panel because he published a really insightful and impactful blog titled Learn to Soar, dealing with burnout in the animal care industry. And in this blog, he uses the most brilliant analogy of vultures and mental health, which we will certainly be asking him to talk to us about.
And finally, but certainly not least, is the wonderful Sarilana Warilan, a professional facilitator and coach with specific interest in leadership and behaviour change, conservation education and communication. With almost 2 decades of experience, Sari has championed mental health awareness and support after seeing her colleagues struggle as well as her own battles. Previously working for organisations such as Rare Indonesia, Sari has now co-founded Digdaya Seralas, an agency that focuses on developing people who are working in sustainable development and conservation sectors. Sari is currently developing a program for NGOs to discuss mental health and well-being within their organizations, recognizing it as an essential component of organizational development and success. So welcome to all our speakers.
And thank you to all of them for giving us so much of their time. So the first question that we've got is for Kyle. Now, as I mentioned in your introduction, you wrote an article comparing burnout in the industry to the flight pattern of vultures. So can you tell us more about what inspired you to write that article and how we can all learn to soar?
Yeah, thank you. I'm excited to be here. So thanks for having me, everybody. So that article, the sort of main thesis around it was, and it's titled, dealing with burnout in the animal care industry. And that's on purpose because I think, to a certain extent, a lot of these emotions that we're feeling and the burnout that we experience, they're more inevitabilities in a field that we are, lucky enough to work in, that we really are passionate about the work we surround ourselves with. So the analogy in the sort of article was, vultures, they sort of have 2 separate flight patterns where they're flapping their wings. They're not really very good at doing that over long distances. If they had to flap their wings all day, they wouldn't be flying very long. So they will flap their wings in order to get to thermals, which allow them to soar sort of effortlessly. And that's sort of what I have experienced in my career, and I'm sure a lot of people have as well. The flapping of your wings, which can lead to burnout, is something that is inevitable, and sometimes you have to get through those tough times, and you have to be doing those projects that you might not be super in the mental space for at the time, but eventually you will hopefully get to those areas in your career where you are soaring. It does feel effortless, and it's feeling great. So that was the sort of idea around it, and the reason I wrote it was because of a lot of the stuff I was seeing online. It was very much I was noticing a lot of my colleagues and a lot of people in some forums and groups and stuff that I'm a part of that really, it seemed like burnout was sort of on the rise, and a lot of the dialogue about it was about avoiding it and about trying to completely sort of reframe the way we're thinking about it. And my sort of thesis there was to be figuring out how to deal with it and figuring out the projects and the things that you can work on that really allow you to soar, and how to sort of focus on those to get you through the times in your career that you might be
to flap your wings.
No, I think that's great, Kyle. Whenever we're talking about animal welfare, we always talk about prevention is better than having to just react to something that's already happened. So that's a great thing to highlight there. So thank you so much for that answer. And yeah, if anyone does want to read that article, I highly recommend it. We've put the link to Kyle's Wild Enrichment page up on the chat, and do have a little look out for that blog because it is really inspiring.
Thank you.
And I think that leads us perfectly into our next person, Sari. And Sari, prior today, along with our other speakers, you gave us consent to ask about your personal mental health challenges, and you've said you'd like to share about those while you worked in the NGO sector and government fisheries department. Could you please share with us some of your challenges that you've experienced, how you've worked through them, and now how you're finding strength in it by expressing it and talking about it with other people?
Thank you, Elliot, and thank you for inviting me here to share. It's also lovely to see several names that I know in the participants. Yeah, it has been, I mean, if I reflect back, I really resonate what Akash and Leona said previously, that when we experience it, we are actually not knowing that is the something is wrong with our mental health. So yeah, for the story to be short is, so one day I was in the field in a fishers community, and I woke up with a very severe pain in my joint. I remember my teammate, she's here also, saying like, "Oh no, you're stressed." And with all my power, I said, "No, why? I'm not stressed. I could not be stressed." So it's really hard. I mean, I didn't even realize that is stress. So I went to the doctor after go back to my hometown. All the physiological tests was good, and the doctor is only giving me vitamin, which I went back home very angry because I know I'm in pain, severe pain, but the doctor just gave me a vitamin. And so I know something is wrong, but I could not articulate it. And then because I could not articulate it, I could not tell, like I couldn't tell my friend, even my family. And then it became worse. I could not read. So I could not open, like, so I usually like multitasking in my screen, but I could not. I could only read like one short emails, like not like the letters just keep flying in front of me, and then I start losing some memories about my family. So if I open my photo album, I could not remember like the feeling and what is happening. And so I really like I know something is wrong, but I could not share to anyone, because at that time I feel like, okay, if I'm sharing this to like my team in the office, or especially to my team in the office, I feel like I'm showing weaknesses. And because I'm working with, at that time, I'm working mostly with male co-worker and supervisor, I really don't want to be seen as weak. So one thing I remember is that because I used to have these sleeping problems, and my belated fathers teach me this breathing exercise. I tried the breathing exercise, doesn't work. So then I start looking into like, what is the tool I can manage with this. So I find a retreat, a 7 days retreat of silent retreat, which is a health meditation. And that is after that health meditation program, I realized that I am actually having a very strong burnout episode. It was a dark period at that time. It took me more than 3 years to like function, and up until now, I'm getting better. I can read books. So this year I finished 3 books, which is for me is an achievement, because before that, I mean, I love to read, but when that dark period happened, I couldn't even read emails. So reading 3 books this year is really an achievement for me. So yeah, I mean, and then what I learned from that period is to be more aware with body sign, practicing self-care practice. So yeah, it's yeah, that's why, I mean, if you're not, I mean, why, for example, I feel this webinar is very important is to have, so don't experience it. So this is like how you prevent it. There's a lot of people that already share like you're not knowing it after you experience it, but do not experience it. It's very costly, and it's very hard to get to bounce back from that situation.
I completely agree with you there. And I think something that was really poignant that related to my personal experience was that ability to function for at least a period of 6 months. Like I quit my job, moved back home, couldn't really concentrate in my next job. It was really hard, and you just can't function. You lose friendships, you lose connections with family. You just sort of cocoon into things when you really have a serious burnout or breakdown. So it's a highly troubling period. And I really like how you say, it's like, you know, it's prevention is better than cure, and to check in before you get to that situation. I mean, we are all exceptionally passionate and empathetic individuals, and we push and we push and we push, but often that's not the best thing. And so I really thank you for sharing what you've told us today.
And sorry, I have to agree. I've gotten physical signs of stress before, which I was convinced it was anything other than, for about half a year, I couldn't breathe properly. And I was convinced like my lungs were dying. There was something wrong there. I was convinced that it had to be something physical. And it turned out it was just stress. And it is so incredible to hear that, almost, and also be given that permission almost to kind of say, yes, you are stressed, your body's feeling it, but your mind hasn't caught up to that yet.
Exactly. Yeah.
And also what you were saying, it's not a weakness at all, no matter what gender you identify as well, no matter what gender your manager is, it should never be seen as a weakness. So thank you.
Yeah, agree with that, Sarah. It's actually a sign that we're human.
Absolutely. We're all Homo sapiens, and we all need to just acknowledge that. Nobody's perfect. Thank you so much for sharing that, Sari. So next up, Heidi, are you able to share with us the development of mental health awareness in Animals Asia Foundation and the support programs that you've adopted?
Sure, thanks, Sarah. It's such a pleasure to be here. What I want to share is some of the practical approaches that we've adopted at Animals Asia and here at the Vietnam Bear Rescue Centre. The first thing I'll say is I'm not a mental health professional, but what I am is a manager of people that cares very, very deeply for their well-being. So my heart broke a little bit to hear about the person who had a manager that maybe doesn't see the importance of looking after people. I hope that something can be improved there. You mentioned a little before in the introduction that one of the things that Animals Asia has rolled out, which I understand that there are people from different tiers in their organization joining the call. And so while it may not be within your remit to be able to action this, I'd encourage you to talk to your managers or those who can. Animals Asia rolled out an employee assistance program, and that provides free mental health care to all of our staff right across the globe. It's culturally appropriate because we have licensed therapists now based in each of the countries where we work. So we have Vietnamese therapists, Chinese therapists, therapists in the UK, the US, everywhere. So this is a service, and especially when we're talking about being in different countries where perhaps there's different stigma or different comfort in talking about mental health issues, this is one way that I think we can address it. There's a lot of other things that we do here at the Sanctuary as well that are practical in their approach. I think one of the most favorite things of mine that we've done, and I'd like to share with everyone because it's very, very cheap. It's very easy to do. And it's something that's taken on a life of its own. And that's a practice of gratitude. So if you look into any of the research from the last 10 years, you can see that there is a clear link between practicing gratitude and experiencing higher levels of mental health and physical health. And so here at the Sanctuary, that's what we set out to do. And we started something called our gratitude bear. We rescue bears. So we have our gratitude bear, and I have him here. And you can see when I hold him up, how cheap and easy and achievable a program like this is. This is all he is. He is a plastic jar in the shape of a bear. Choose your jar with your appropriate animal. And we stick him to the wall in a really highly visible place in our offices. And each member of our team is given a whole bunch of colored pieces of paper. This is as big as the investment's going to get, a plastic jar and some colored paper. And throughout the course of the month, people can leave notes of gratitude on pieces of paper, pop them in the jar, and at the end of the month, I type these up and circulate them to the team. And I think what this does is it gives us back a sense of control. It helps us to refocus on the good, the progress, the achievements, and the small things. And I think that's something that Leona was talking about in her talk as well, about really focusing on compassion, satisfaction, I think it was called. And that, I think, you know, it resonated with me because it reminded me a lot of what we're doing here. It's a small thing that I advocate for, because I think no matter the budget, no matter who you are in your organization, whether you're a manager or a team member, I think you can start something like this. And I'd encourage you to do it. We've been doing this since 2019 religiously every single month. And it's, yeah, like a family member at this point.
I absolutely adore how accessible that is for everyone. And to start off with something positive, because many people here would know the work of Animals Asia over many years, and you do encounter very troubling situations with your mission to rescue bears, cats and dogs, etc. And so something like that really is practical and brings it back to everyone in the team that you are making progress, and also that everyone is being seen. So it's absolutely brilliant. And thank you so much for sharing that with us. To lead on from that, also, you did mention you work, and Animals Asia works across many countries and multicultural teams. So a question to all our panelists is, I guess, how do I ask this sensitively, is that within the global north, within Western countries like Australia, where I'm from, mental health is something that's discussed far more than it's... Please don't distract me with cats on screen, Heidi. It's becoming more common to just sort of reach out and just say, are you okay? Let's have a conversation about things. Do people with their different experiences around the world feel that's how that's developing in different nations, which may, or different cultures, which may have always held a you keep these things to yourself attitude in the past? Maybe we'll start with Heidi and move on to Sari afterwards.
It's a really good question. And I have Vietnamese colleagues here on the call with us. So perhaps they could share, if they're comfortable, some of their thoughts on mental health or the stigma around it here in Vietnam. I don't want to speak on behalf of my Vietnamese colleagues. All I would say, as a manager of a multicultural and very diverse team, that I think success lies in being grounded in reality and listening to your people. That's one of the central tenets of the way that I manage the team. The team, if you create as a manager psychological safety and hold space for the team, they'll tell you what they need you to know. It may mean setting something up so that people can report back to you anonymously. So we have an anonymous staff survey that goes out quite regularly, or having an open door policy and things like a weekly one-on-one catch-up. And I think that these tools over time, when you prove to your team that they can trust you, that these transcend cultural barriers. This is a core human commonality, I would say. So that's something that we do here.
That's really, I'm loving all these essentially cheap or free options where you can start to develop this awareness of mental health within your own organization. I have to say, I'm very proud to be part of Asia for Animals, because we really also have that really open door policy. Despite everyone working online, we do have a great policy like that as well. Sari, what are you finding in Indonesia? How is the conversation around mental health developing?
Yeah, thank you, Elliot. So I'm not going to generalize for all Indonesian, but this is like what I observe and encounter with coachee that are coming from NGO, several conservation NGO in Indonesia. So in terms of conversation, point, at least in the social media, it is much more available and accessible now compared to where I'm coming from, working in the in conservation sectors about 5 years ago. So it is much more open now. In terms of being open to talk about it, I think there is still some challenges, like in one-on-one. So for example, in one-on-one conversation with a few of my coachee from NGO sectors, there is always the mental health, the stress, the fatigue is always one of the talking point in the coaching session. And so it is there. Yet when, in our agency, we try to, one of the effort that at least this year we tried and put more effort to educate, build awareness around mental health, is that even for free webinar, only a small participants are coming from the the NGO sector. Most of it is mostly coming from professional commercial sector. And so that's one interesting point that we're still trying to figure out, like how we can how we can have much more open communication about this in at least in our NGO network. Interestingly, if we are doing like a personal conversation, again, it always comes up, and like it is an important thing. But then investing money to participants in training or capacity building that relates to like knowing your emotion, knowing yourself, it's still a challenge.
It's very similar to what Heidi said. It's investing that time, which is, at the end of the day, it's free. You've just got to prioritize it with everyone. And I guess finally to Kyle, do you see within your zoo work and in Canada that this is something that's becoming more open to speak about in your experience?
Yeah, absolutely. I've found, there's a lot of like large zoos that are, have a lot of resources for their staff, and there's accrediting bodies like AZA and those places in North America that are definitely putting this at the sort of front and center, similar with like EDI initiatives and all those things, which is great to see. I think where the challenge still is it's one thing for an organization or a company to have this sort of messaging, and it's another thing for these very small animal care teams that are, the 8 to 4 to 10 people sort of thing, to be sort of like experiencing that as well. Because, if you're working in a team of 4 people and the dynamics aren't there, the space to be able to talk about these things aren't there, your experience might not be necessarily in line with what the company is putting out. So and it was mentioned before for like managers and supervisors, that's why it's so important to be sort of monitoring these smaller teams to make sure that everybody is experiencing what they should and aware of a lot of these resources that are being put out, and that they're actually effective to these people on the ground.
I think you're completely right. And I think, speaking from perhaps a Sanctuary and Rescue Centre point of view, is these are very small teams, often not with a lot of resources, where they can, implement something, say, as Animals Asia has. But you've all demonstrated that it's just the start of it is like, we're not here to solve all the problems today of mental health, but the start of it is having conversations, trying to be open and having that level of respect to talk to each other. And that's similar to what Akash was doing before in his teams, is facilitating these roles where people can actually start to talk about it. Okay, Sarah, did you have another question?
Yeah, so to everybody, if you do see, say for example, somebody sees a colleague in their team that is struggling either as a manager or a co-worker, how do you start those conversations with them to check in on them, to check that they're okay, especially if your workplace culture doesn't yet have that kind of focus on well-being? So Heidi, should we start with you?
Sure. Animals Asia's work culture does have that focus. So I think we do a really, really good job of normalizing talking about our well-being. So in that way, we're in a very privileged position where I guess there may not be some of those structural barriers in place to being able to have these conversations. Speaking just as a manager with my team, I would ask people in private and with compassion, and try and meet them where they're at. So I don't expect people to open up to me if they're not comfortable, but I give them the opportunity to, if they would like to. And then again, I encourage people to use our employee assistance program. So I'm a vocal proponent of that service. So rather than waiting to see people struggle, I try to constantly reinforce that the team's mental health and mental well-being is just as important as their physical well-being. So I guess it's a dual approach, being open and checking in with people one-on-one, but then also constantly reminding people that services exist and they can reach out for help if they need it.
That sounds so important. Again, just normalizing those conversations as well, not making them a really big awkward thing, just saying, hey, I'm here if you need me, and yeah, making yourself accessible if you are the manager or you can see that someone's struggling. Well, thanks so much for that insight, Heidi. Sari, anything to add from that?
Yeah, just to add on what Heidi mentioned is that one thing that I'm now more sensitive to is when having a colleague that repeatedly, how you say it in English, sick absenteeism due to sickness. Don't wait until repeat asking for permission, but do early check-in and having a conversation about what they're feeling, how the sickness related to the work would be an effort that we can do with our colleague. And for me is keeping a list of professionals that offer services for free is also handy.
Yeah, resources are our best friend always. And then Carl, did you have anything to add to that?
Yeah, not really much to add. I completely agree. I think like these conversations, they sort of start with a foundation of having these relationships with your coworkers and maybe if your subordinates, if you are sort of in that management role, and fostering those relationships so that people are feeling comfortable bringing these things to you, and that's where a lot of these sort of cultures really start. So
Oh, fantastic answers, all three of you. Thank you. We did have a question from one of our attendees, and if you do have any further questions, do continue to put them into the Q&A. We just had a question, and Leona or Akash, maybe this is for you two. Are compassion fatigue and burnout the same thing? So Leona, did you want to go first?
I think I put an answer, but I'll say it again. No, they're not the same thing. It's a bit complicated, but they have similarities for sure and overlaps, but I'd say that compassion fatigue is frequently a precursor to burnout, and burnout is like the end of the line when you can't function so well anymore. Compassion fatigue, you can still function really quite well sometimes, just not in the same way, but burnout, you're kind of done. Simply put, it's more complicated than that.
And Akash, what were your thoughts on it?
So first of all, I'm not a psychologist, I'm a mental health advocate, so I think Leona would be a better person to answer that. So yeah.
Okay, great, thank you. So we do have another question that's just come in, if I can find it. And it's basically how we can support colleagues with how they're feeling, but how do you think it's best to deal with perhaps an environment that's becoming quite toxic towards mental health? If people are making accusations, for example, so-and-so's gone mental or something like that, how can we deal with that? And if anyone's got some thoughts on that, then whoever thinks that they're best to answer that.
I guess that's a very tough question, Sarah. And I mean, learning from my own experience, one thing that I do is having myself in control and having a positive perspective toward the situation. So basically it's helping myself to be able to like manage the situation, seeing the situation from a different light. Yeah, I mean, that's the thing. I mean, so this is one thing that I learned, have a realistic and relevant goals, because that is managing our own expectation, and have reach out for help in order to be able to have a clear mind in making decision, even for ourselves or our team. Just make sure any decision that we take is made with clear thinking and not based on how you call it, like anger, frustration, or else.
Yeah.
And I think I'd like to share a personal anecdote there. Is just I've been in that situation before where I've been a manager and my mental health was not in a good place, and it really affected the entire team. And so it was, in retrospect, very challenging. I saw everyone's point of view from it. We all tried to support each other the best we could. But when it's not right, it's not right. And you need to know when you need to step out of a situation. You need to know when to have that reality stick to check yourself, to go like, the decisions I'm making in this moment, what are the feelings they're based on? Do I have a clear mind? And sadly for myself at the time, it wasn't. And it was challenging for myself. I could see that in myself, and challenging for people around me. So yeah, that's a brilliant point you bring up.
And once again, Elliot, thanks for that honesty, because I know how hard it can be. Okay, so I think that brings us to the end of our panel session, guys, because we have been going for 2 hours now. But obviously all our speakers have donated their time to discuss this vitally important topic. So if you or your organisation would like to learn more about them, donate to NGO projects or access the tailored services provided by their companies, then their information can be found in the chat now or via the speaker profiles on the AFA event page. And finally, if you've got an NGO that's interested in joining the Asia for Animals Coalition, or indeed you'd like to learn more about wild welfare and what we do, then the links are also now in the chat.
We will also send out a follow-up email to everyone in the coming days. We are also placing a feedback form in the chat right now. If you could all take a couple minutes just to fill it out, because it's really important we get feedback about these events so that we can make them really good into the future and to get your opinions on them. Finally, if this event again has brought up any issues or feelings, please look out for support of friends and family, seek help from a medical professional. We are also placing some links, as we have done throughout the whole session, where you can find a helpline. And Asia for Animals is developing a resource database, which we'll share in the chat now with everyone, where you can start to find resources that can help you get through these things.
And then finally, a reminder that this event was indeed recorded. I remembered to press the button, so I'm very happy about that. So if there is any part of it that you want to watch back again, it will be available on both the Wild Welfare and Asia for Animals YouTube channels in the coming weeks. And on behalf of all of our speakers and panelists and the teams at AFA and Wild Welfare, we want to thank you massively for joining us and helping to start this really important conversation about mental health in captive animal carers. So thank you so much to everyone who's joined.
Really, thank you very much to everyone who's come today and donated your time to be with us. And I think, as me and Sarah discussed before the event, and people have alluded to today, is that good people welfare can equal good animal welfare. So if we can take that home as a message that we need to look after ourselves as we want to continue this mission to help animals. One final thank you to all the AFA staff behind the scenes who helped us in the chat, managing the Q&A. And again, thank you to all our speakers and panelists for joining today. Thank you so much, everyone. We really, really appreciate you starting and joining us on this conversation about mental health awareness. So thank you.
And remember, everybody, it is okay not to be okay. Thanks again, guys, and see you soon.
Goodbye, everyone, and thank you.